Okay, welcome to today's webinar. My name is Dr. David Kunashko. I'm the medical director, at BIOFLEX Laser Therapy. And I'm a chiropractor, practice also acupuncture, traditional Chinese medicine. And prior to that, I was a bit of a scientist in molecular biology, molecular genetics at University of Toronto. And today's webinar is a second one now on our LED panels. They're referred to as the BIOFLEX WAVE ZONE or Zone XL. And so far they've been received quite well, but there are some features I didn't really get into in the first webinar. And some people have been asking me about it, and I did recognize that I didn't really have time to get into it in the first webinar. So really today's webinar is meant to delve a little bit more into depth about some of the features that you see there, but maybe aren't quite sure what to do with, which is understandable. There are preset modes, and I won't go into those again, other than just introducing them, because I did talk about that a lot in the first webinar. So really today is more about how to use some of these features and customizable features in the equipment. As usual, if you have any questions, just type them into the Q&A box. At any juncture, that's fine. I'll be answering those questions at the end of today's webinar. You're free to chat amongst yourselves. Maybe let me know in the chat box your name and where you're from. It's always fun to know that. And also, if you have purchased an LED panel, that's also helpful to know. Maybe you're just interested in panels in general. There's, as usual, a lot of misinformation out there, unfortunately, even by some of the big, LED panel. I wouldn't say they're manufacturers, because they don't actually manufacture them. They have someone in China manufacture them, and then they put their brand on and they sell them. But regardless, there's a lot of information that's not really overly accurate as far as what the science and the research goes, although there's not a lot on these panels, so that needs to be understood as well too. So I'll talk a bit about that. I'll talk a bit about the modes of operation, and then I'll get into specifically some of the features in our equipment that you can change or alter, and why you'd want to customize these features and kind of play around with them. It's kind of fun to do. All of our equipment in the professional realm has the ability to do these things. So we included it in these panels specifically because we know that they can be important in helping healing. And then I'll get into just a bit of a recommendation on how to use the equipment, kind of a bit of a repeat from the first webinar, but maybe a little bit more information. And then certainly I'll have time for your Q&A, for your questions, and hopefully some of my answers. So again, just to know what I'm talking about today, if you go to bioflexwave.com, that's our consumer level red light or photobiomodulation devices, separate from bioflexlaser.com, which is more geared towards our healthcare professionals and that kind of thing. So today we're specifically dealing with the light panels, the Wave Zone, the Wave Zone XL that you can see on that page there. So, the red light therapy is not an accurate term, but that's the one that seems to gravitate, and with consumers, that's the way it's being advertised. So we have to follow, unfortunately. But really, it's referred to as photobiomodulation. Red is great; it's a great wavelength, but it's certainly not the only one used in photobiomodulation. So again, it's a bit of a misnomer. Now, when you're talking about the benefits of, and I'm going to say red light therapy, photobiomodulation therapy, it's all the same kind of stuff, but terminology aside, the research, if you look at the research, now by research, I mean like randomized clinical trials. So you have humans get the treatment, some of them get placebo treatment, they look to see what's going on, if there's statistical benefits to treatment. Nearly all of that research uses equipment that touches the skin. So they use LEDs or they use lasers, and they impart a specific dosage of light into the tissues that's measurable. And then they look to see if there's benefits. And that's what we refer to as the benefits of photobiomodulation. And that's great. And typically that's what has been shown to be beneficial for lots of different conditions, osteoarthritis, muscle strains, all sorts of different things where the light's being imparted. You can measure the dosage and see if there's benefit. Oftentimes, most of the time, there's benefit if they use the right dosages. Now, all this comes about as a little bit of a history. I love history of this. Is Andre Mestre. I actually had the pleasure of listening to his son lecture quite a few years back at a world conference. So it was really fascinating. But Andre Mestre, he was a medical doctor and professor in Hungary and Budapest University in the 40s and 50s during the World War II, in fact. And anyway, he came across red light therapy. Actually, he wasn't using like panels, but he was using lasers. And he was trying to use high-powered laser to actually eradicate tumors in rats. And what he actually ended up noticing was that the incision where the tumor cells were put in were healing faster. Then he did the subsequent experiment and many others to show that the red light benefit had benefits for wound healing. The laser he was using wasn't high powered as he was expecting, it was lower powered. It was calibrated incorrectly or made incorrectly back in the day. This is when lasers were just first being made, and they were red. They were actually using a ruby core, man-made ruby core laser to get the light, and of course rubies are red. So anyway, what he noticed was that this red light had a healing effect on wounds compared to the control. So what you're seeing here are shaved bellies of rats, obviously, and on the left of your screen, there's two different sizes of wounds. On the right, same sizes of wounds, same time frame, but this one that's circled here was treated with red light directly. So you can see, if you compare the two, you can see it's healing a lot faster. Now, the wound just to the left of the one that's circled is also healing faster than the control. It wasn't touched by red light. So what's interesting was that Mestre kind of concluded a couple things, and he went on, by the way, to do human trials and experiments and used it a lot in wound healing and all sorts of things. He was really the pioneer of using specific red and near infrared wavelengths for tissue healing. And he concluded two things. One is red, and then later he realized near infrared works as well, is that it can help tissues heal faster through mechanisms unknown, although he had some ideas why that was occurring through experimentation. And also, and that's directly, so you get this light directly on the tissues and it helps to heal. So we see that a lot. Now, the other benefit is systemic in nature, and that's where the panels come in. And that's why I'm talking about this, is because the benefits systemically is where you treat an area and the effects that will be mediated, in fact, by things in the blood are circulated within the blood. And so the effects actually are systemic. So when you are exposed to red light or near infrared light on your skin, although you are treating your skin directly, what you're not treating probably directly is much beneath your skin. And that effect will be mediated more through the blood. And that effect, there's many hypotheses what's going on there. Some have been proven for the most part, like the effect on white blood cells, where these white blood cells that control inflammation are immunomodulated, and they have different states. They have an inflammatory state and an anti-inflammatory state. And it's shown that photobiomodulation can shift these cells to produce anti-inflammatory mediators or chemicals that help resolve inflammation. So you can imagine if you're treating your blood for a period of time with the correct wavelengths of light, you can sustain sort of an anti-inflammatory effect where that blood is going. Now, the effect is stronger the closer you are to where you're applying the light. So that's what was referred to as systemic effects. So again, review, there's direct effects where the light's being absorbed directly by cells. And then there's indirect or systemic effects where the light's being absorbed by the blood, in some cases in the bone marrow, but LED panels won't be doing that because they can't penetrate in through bone at all. And it's hard to get light into a bone marrow anyhow, although if you're using equipment that's on the skin that's powerful enough and right dosage, you can get light in through the bone marrow, say in the cortical bone, through the cortical bone in your sternum, for example, to maybe affect bone marrow. There's been research to talk a bit about the effects on bone marrow as well. Okay, so red light panels really mediate the effects via this systemic effect, although there's not tons of research on it yet, but it's kind of extrapolated, but it's not exactly the same as when you touch the skin. So this is why when people, I get a little, I try and make it really clear, but I still get people buying stuff and then not realizing what they're trying to do. So if you have an injury, say, I wouldn't be buying an LED panel to help that injury. Would it help? It probably would help to some degree, but it wouldn't be the optimal choice for using photobiomodulation to help with your arthritic knee or your, torn rotator cuff or, injuries or things that are trying to heal. For that, you want to use devices that impart a certain amount of dosage directly on the skin and preferably kind of can push into the skin and get that light to these tissues to impart healing. Where the panels come into benefit is mediated through this more systemic effect that can kind of go in your body in the general area that you're treating. The light does get absorbed by the epidermis and the skin, so it is really good for skin rejuvenation, the panels, for sure. And maybe a little bit deeper, but not a whole lot deeper. So when we talk about the light that's penetrating, we're talking about red light in the range of 630 to 660. Those are the wavelengths used. And don't listen to, or don't believe when you read things from, I don't know, different companies or whatever that are trying to sell you on a specific wavelength. That's nonsense. There's a range that we know that's beneficial. So in the red, it's a range. It's roughly 630 to roughly 680 nanometers. That's red. So anywhere in that range is probably going to be beneficial. Are there better wavelengths in there? Maybe. 660 is one that tends to be used the most, so it's probably the most beneficial. But hey, if you got 640 or 680, it's going to help, okay? Then you have near infrared, and that's going to penetrate maybe 3, 4, 5, 6, 7, 8 millimeters. That's effective, even though you might think, oh, it's going deeper than that. You can, you shine red light on your finger, you can see it going right through. It's not going through, it's just kind of bouncing around and stuff. The amount of dosage that's absorbed to make a difference really only affects tissues not much deeper than 5 millimeters-ish, maybe 10 millimeters, around there, but not a lot deeper. That's science, okay? So don't believe anything otherwise than that. Of course, it does affect the blood, and that will go deeper but that's a systemic effect. Now, near infrared, those wavelengths range, whoops, got ahead of myself. Those wavelengths range from 780 nanometers to around 900 nanometers. Are there better ones? Maybe even 1,000 nanometers, but to be honest, the main target is in mitochondria and a specific enzyme, and that seems to absorb better at wavelengths around 810, 830, 840-ish. There's science to show that, and some red wavelengths as well. So yes, there are better wavelengths. As you're getting higher, like to 900 to 1,000 nanometers, less absorbed by the mitochondria probably, but maybe more absorbed by other photoacceptors they're trying to figure out, like ion channels or water. Still trying to figure out what's going on there as well. There's a lot of unknown stuff. So we know there's benefits, but as soon as you start to read stuff exactly to say, oh, this is how it all works, it's like, no, we don't know yet. We know a lot, but we don't know. But we do know certain wavelengths are more effective. And these are the wavelengths used in our panels, kind of, ranging from orangey reddish to red, 610, 630, 660. Out of these three, I'd say 630, 660 would be the optimal. We chose a slightly shorter wavelength as well that seems to have benefit for skin, so that's part of it. And then the near infrared, 810, 830, 850, those tend to be the range of near infrared that's going to be most beneficial. But again, I'm not going to say 780 is not effective or 900. But these are the ones you see a little bit more in the research. And then the power and all that, that's not overly critical for LED panels. Whether you have the large one or small one, the specs are pretty much the same, other than obviously there's less power outputted by a smaller panel. I see you have some questions here. That's great. I'll get to those for sure at the oh, I forgot my water, shoot. At the end of today's webinar. I see someone raise their hand. Hey, Alan, I'm not sure if you did that by mistake or not, but I will get to those questions at the end. Okay, so on the controls on the panel, obviously a power, you push the power, and then you can set red and near infrared intensity. You can set the running time, and you can set the pulse rate, but it's only for near infrared. I don't know if you tried to play around with it, but pulse rate or pulsing is only going to work for the near infrared, and I'll explain why shortly coming up. And then there's buttons to go up or down. So you can change the power from 0% to 100%. So if you just want to run red, you could do that. You could customize it, shut off the near infrared at 0 power, and then just turn on red. Why would you do that? Well, if your target is just skin, that might be a benefit. Now, there is a beauty mode, but you can play around with it, play around with customized features, and maybe just target some superficial stuff like skin and just want to use red. And by that, you can shut off the red. Similarly, you can shut off the near infrared. Similarly, you can shut off the red and just use near infrared as well. Why would you do that? Well, maybe you just want to target something deeper, and near infrared will go a little bit deeper. So that would be an option to do that as well. And then, of course, it can pause the timer. So here's the thing. We're dealing with visible and near visible light. Here is the electromagnetic spectrum, folks. It's huge, all the way from very, very long wavelengths, like radio and power lines and EMF, that kind of stuff, to microwaves and infrared. And then you're getting shorter and shorter, more energy, getting into the visible spectrum. Roughly at blue-violet is where you're going from a non-ionizing radiation, which is safe, to ionizing radiation, which is inherently not safe because it has so much energy, it can break covalent bonds in DNA, and you do that enough, and you can cause mutations or issues with cells that cause cancer, right? So when you talk about the spectrum, this is what we're referring to, okay? I get this question a lot, and I'm going to just say something here, that we have tested our panels for EMF. And at 8 inches, which is the recommended kind of distance away from the equipment, maybe hard to see, but it's reading 0, okay? There is, at 8 inches, there's no EMF. For those of you who are concerned about EMF, I'm personally not concerned really much about EMF. I'm going to say this. I have not read anything compelling in research to say that exposure to Wi-Fi or stuff coming out of your computer is going to give you cancer or be severely detrimental to your health in normal, healthy, what we're exposed to on a daily basis. And if you don't want to be exposed to it, you're pretty much going to have to live in a lead bubble or in the middle of the forest not to be exposed to it. Just a reference here with respect to its safety. But regardless, the equipment is safe with respect to output of EMF. Okay, so this is the first webinar you're watching on the LED zone panel. Once this is done, when you have time, watch the first one because I run through all the different modes. These are pre-programmed intensity and pulses of light to help recover, muscle recovery, technically, before or after you work out. A light for helping with weight loss. There's some evidence to show that it may be helpful. Muscle recovery. Sorry, the fitness mode is more for improving the well-being of muscle tissue. Muscle recovery is more after your workout to help delayed onset muscle soreness. I saw a TikTok the other day, and It's so I love TikTok, man. Just because some of the things are pretty fascinating. But they talked about this one condition called rhabdomyolysis or something similar to that. This is where you work out so much that you cause extensive tissue damage to your muscles, like way more than delayed onset muscle soreness. And the muscles have a hard time healing, and they start to release the breakdown products of muscle tissue damage that the kidneys have to try and filter, and it mucks up the kidneys, and it can be a really serious condition. So I mean, I knew about that condition, but it just goes to show you that you need to listen to your body, when you're working out and stuff, and it can happen. I mean, I was surprised it happened to this particular person. They showed her after doing a workout, could barely go down the stairs, that kind of stuff. I mean, you got to listen to your body, but I think we've all been there and maybe worked out a little too hard, but that's to the extreme. There's beauty mode for skin, longevity for overall systemic effects, and inflammation mode to help reduce inflammation in the area, and relaxation and more of a sleep mode to maybe help you help improve sleep patterns. Okay, so those are the modes. Those are preset. If you want to choose those, feel free to do that. Watch the first webinar and walk through how you would do all that. This is the power density. Power density is the milliwatts per centimeter squared. Of course, the power decreases as you go farther away from the panels at 4 inches, 8 inches, and 12 inches. And generally speaking, if you want the panel to be super effective, you're going to expose your skin approximately 8 inches. I mean, 6 to 8 inches to 10 inches, maybe up to 12 inches is good. Anything farther away from that, the benefits are going to start to decline. You might have to be in front of it for much longer, and I don't think it would be as optimal. You don't want to be too close. They do get pretty warm. So, at 4 inches, you're getting pretty close. So at 6 to 8 inches is pretty good for how far you want to be from these panels. So now let's get into the customized modes. Wow, I've already been blabbing on for quite a while. So these customized modes essentially allow you to change the power output from 0 to 100%, or the pulse rate from 0 pulses. So it's a continuous stream of light, or up to 9,999 cycles per second, or hertz. And I'm going to run through this. So what is pulsing? Okay, so literally, it's a mechanical way of chopping the delivery of the light. And I'm going to show you some examples. So if I pulse at 1 second, I'm flashing the light every second, right? Once per second. When I get to 4 cycles per second, or hertz, it's measured in hertz, which is a cycle per second. That's 4 flashes in 1 second. So you can imagine when you get to high frequencies, that's pulsing at a really super high rate. Okay. And the important thing to understand that is when you're pulsing the light, the benefits of the energy coming out is the same. It's just that it's spread out over particular points in time. So it doesn't really affect your overall dosage, but what it does do is it delivers the energy to the body in different ways. And some of that's understood a little bit, a lot of it's not, but I'm going to go through some of the theories, not in depth, but just so you can understand why you might want to play around with this. Now, a lot of this research comes from Adam Mester. Remember Mester? Okay, this is his son. So I actually listened to him lecture at a conference quite a few years back in San Diego. And, what he's hypothesizing here is that cells have different energy requirements. Okay, that makes sense. Muscle cell probably needs a lot of energy, right? A fat cell, not so much. A neuron, a lot. So I don't know what the percentage is, but when you're resting there, not doing a whole lot, like there's a high percentage of the energy, glucose in your blood, that's going to your brain to keep it operating, like a lot. And then you start to use your brain more, it's requiring even more. So nerve cells have lots of mitochondria because they need lots of energy. Therefore, they're actually very sensitive to light. And in fact, the amount of light and how it's used is a little bit different than other cell types. So it kind of makes sense that if you can deliver light in a way that is specific to different cell types or tissue types, like muscle, bone, ligaments, tendons, like, skin, then you can sort of fine tune the way the light's being used. So if I can explain, when you give energy or light to the cell, it needs to do something with it. Actually, it's absorbed. It causes a photochemical reaction. Too much of that light will cause a negative feedback loop and slow the positive stuff that you're trying to do. Too little light does the opposite. So you don't want to bombard it with too much energy. At the same time, you want to give the cells the ability to use that energy in a way that's most efficient. So when you pulse a light, the light's on, then you get ATP production and some positive things going on. When you stop treating, or say you pulse the light, so you flash on, then when it goes off, right, what happens is ATP levels go down. You go, well, why would you want that? Well, think about if you've ever camped or started a fire or whatever, where you're putting wood on and you're trying to get a fire going. If you put too much wood on it, it goes out, right? You want to start with a little bit of wood, get it going, and then slowly feed that fire. When it goes down, you feed it, it goes up, it goes down. You know what I'm talking? So when you're giving the energy, you want to give it enough to get things going, but then you need it to use that energy efficiently. And then as it's going down, you stoke the fire again and give it some more wood. In this case, you give it some more light energy. So by pulsing the light, that's what you're doing. Now, we find that overall, pulsing has more of an effect with near infrared than red. We're not quite sure why, but we've been doing this for over 30 years, actually pushing 40 years now in our history of BIOFLEX. What we found is, for the most part, red light being superficial and really pulsing that red light doesn't seem to have as dramatic an effect, or really as much of an effect or any effect, than pulsing the near infrared. And that's kind of why we stuck with pulsing near infrared. And we've continued that with these panels as well. Okay, so hopefully that you can understand a little bit about why you might want to pulse light. Okay, now there has been research. And in general, what they found is some of these clinical trials on humans, when they pulse the light, the effects are better. Not 100% sure why, but it seems like it's better. So it kind of makes sense that if you pulse the light, you would probably get better results. And that's what we found as well, too. And that's a big part of what we offer with our equipment, is different pulses of light that go along with the protocols that have been found to be effective for us. In particular, a lot of research has been ongoing with the brain and neurodegenerative diseases like Alzheimer's, dementia, and post-concussion syndrome. And the brain has like 5 different frequencies like alpha and beta and gamma and theta. And they seem to be correlated with different things going on in the brain, like if the brain's relaxed, or if it's cognitively functioning, or different, when it's doing different things, these waves are predominant. And by the way, I'm obviously not an expert in this. I'm not a neurologist. However, what they found is when they pulse the light at certain frequencies that mimic these waves, like beta or and alpha, what they found is that it has a better effect. So low frequencies, 8 to 12 hertz on nerve tissue, seems to be helpful for relaxation to some degree. 12 to 40, usually they use 10 hertz, and 12 to 40, they usually use 40 hertz. But I mean, in that range, it might be more helpful for memory or mental acuity or cognitive. Hey, I'm not saying this is science yet, or proven fact that by pulsing the light, this is what you're going to get, but that's where the research is trending towards. So I just like to put that out there, and it's safe to try it, so why not? So, pulsing the near infrared frequencies, by the way, this is something you'd have to preset, and I'll show you how to do that into the equipment in order to do that. The other thing that everyone mentions is Noguès. Paul Noguès was a medical doctor, neurologist in France, and he was kind of given the credit for establishing auricular acupuncture or ear acupuncture. I actually have, you know, I'm acupuncturist, although I don't do much anymore, just because I'm busy doing this stuff now. But I've used it. It's interesting. I've used it for smoking cessation. It freaking works, like unbelievably works well for addictions. They use it for people overcoming addictions, not just smoking, which is a tough one, but alcohol and other drugs, that kind of stuff, along with other things, right? Anyway, he discovered, or you know, kind of mapped the ear, so to speak. I mean, I think there's a bit of pseudo stuff there, but I don't know. There's things on the ear that seem to do certain things. So I'm not going to be all negative about it, just because I've actually used certain points that seem to be helpful. Regardless, he came up with some theories on a specific frequencies that have certain effects on the body. This isn't really proven with science as far as I can tell, but it comes across a lot. And so, hey, why not try it? You can try it. I mean, there's nothing wrong with it. You can see the frequencies here. Google it. You can learn all about it. You can set the program to 73, 146 hertz. You can see, you know, you can set them all. You know, generally speaking, Noget felt that the higher the wavelengths, the more kind of pain control kind of scenario, whereas the lower frequencies more for healing kind of deal, if you're going to sort of equate that. So yeah, you can give that a try as well. Nothing wrong with trying. Maybe it has some benefits. I'm not overly convinced, but I never really got into Noget's frequencies. I never really did anything with them, but we always get asked about them, and you see them a lot with respect to even these panels. So it's not proven by any stretch of the imagination, but I think it's something that you might want to be aware of and even try. So Noget felt that the higher frequency is more for pain, as I mentioned, and to help sedate or soothe kind of thing. And then lower frequencies to stimulate, especially nerves. And we talked about that 10 and 40 hertz for nerves as well, that they're finding important. Okay, so here's the panel. You know, this is what they're the modes, right? You turn it on. This is what you'll see. If you want to choose a mode, you choose a mode. Now, if you want to change the red, you're going to click on red. Okay. Now, if you just want red only, then you're going to have to go to near infrared and set the power to 0%. That's what you want to do. So the red wavelength, if I click on that, I have the ability to change the power from 0 to 100%. I can't change the pulse rate on the red. Whereas the near infrared, so if I push red, then I can hit the increase or decrease, and you'll see it will go up to 100. If you push and hold, then it will go really fast instead of just like doing one at a time. Okay. And once you've done that, you set the time. I'll talk a bit about treatment time coming up. And once you've done that, then you can run your program. Now, if you want to choose near infrared, then you click on that. And now choosing near infrared, you can change the power or the pulse, right? So if I choose the power, as soon as I choose on near infrared, I can change the power. And then once I click on pulse, I can choose the pulse from 0. So if it's 0, it's steady stream of light, okay? 1 is 1 pulse per second, and then all the way up to 9,999. Okay. So let's take a look. I did some videos here for you. So I've chosen 1 cycle per second of near infrared. And this is what it looks like. Okay. I forget what percent power I had it at. By the way, you can see it because through the lens of your iPhone camera or your phone camera, it can usually pick up sort of a hue, but normally it's kind of invisible to your eyes. So again, this is 1 pulse per second. Sense? Now I need to advance my screen. Now, 10 cycles per second or hertz, okay? And to the naked eye, you can still see this, but it's interesting as you start to increase the power or the hertz, it starts to become invisible. Okay, this is 10 cycles per second. You can see it flickering, right? That's 10 pulses per second. You see the flickering? Okay. This is 30 hertz pulses per second. Hard to see, right? Once you get around 30 or 40, it's pretty much invisible to your eye, the pulse rate. Okay. Just so everyone can understand that. So again, why would you want to change the pulse rates? You can play around with Noget's frequencies, pulse rates that are been known to perhaps help for the brain and cognitive functioning, right? And in general, this is what I would say. Lower frequencies, in general, you'll be less sensitive to. As you increase the frequencies, you can be a little bit more sensitive to. In our protocols, what we found is we generally speaking start with 10, 20, 30 cycles per second. And sometimes we make our way up to 5,000, even 10,000 hertz. But usually the most effective ones, to be honest, are between 0 and 100, sometimes up to 500. But you can play around with them and see if other pulse rates are effective as well. And those of you are going like, well, I mean, I want to know exactly. Well, we don't know. So you have to play around with it. I'm giving you some baseline here on how to play around with it based on the current knowledge that's out there, or lack of knowledge, I guess. So as far as some treatment suggestions go, see I'm running a little bit of overtime here. Few things. Got to have bare skin. Okay. If it's not bare skin, nothing's going through it. I don't like, I went through a whole bunch of other websites of people that sell panels, and like oftentimes I go, oh yeah, you can wear something that's a little, translucent, or, you kind of semi-see. No, it's pointless in wearing anything if you want light to be absorbed properly by the skin. Okay. So take your top off, do it in privacy, whatever, just expose the area that you want the light to be effective for. So that's really important. Optimal distance. 8 to 12 inches to 20 to 30 centimeters approximately. You could go a little closer, a little farther away, but as you go farther and farther away, then you might have to increase the time and or the power. But when you're using the modes, I would say it's good to be about this distance away. It's pretty close, right? So, they show pictures, and maybe we've been guilty of it too. I don't know. I haven't checked the website lately of, someone riding their bike and the panel's like 20 feet away. I don't think it's going to do a whole lot. So if you want this to be effective, maybe it's ambient lighting or whatever, but it's not going to be overly effective. Maybe for your eyes, it would be effective. I'm not going to get into that today, but bright light, red light, especially near infrared, may be helpful for eye conditions. I'm not getting into that, but though. So be aware of positioning of these panels. Time of treatment. Well, start off with a few minutes initially, work your way up to maybe 10, 15 minutes. That's usually around optimal. I get the comment, well, it's set for 30 minutes or whatever. It's like, yeah, that's a maximal time or whatever it is. But it's not what we recommend. You don't want to overdo it either. If you're not getting results, maybe you're overdoing it. So start low, go slow, see how you respond. That's the idea. Usually you want to treat most days. You need to be consistent. If you're doing it here, there, and everywhere, you're not going to see the results. So I also got a question like, can I use it more than once in a day? Different modes more. Yeah, no problem. But I wouldn't treat the same area more than like consecutively. So if you treat it, give it a break, like 5-6 hours at least, if you're going to treat that other area again with a different mode or what have you. In general, 2 or 3 times a day, different areas of your body, that kind of stuff, that's okay. What you don't want to do is just treat that one same area constantly throughout the day. That's not going to give you better results. And as far as when you'll find these things to be effective, and if they're not effective, what do you do? Well, you need to play around and experiment. As practitioners do, clinicians do. If one thing doesn't work, you try something else, but usually going to start low, go little bit higher. So start lower frequencies, unless you want to specifically use a higher frequency for something. Start off with a shorter duration of time, then increase the time, that kind of thing, and then see how you respond. Give it some time, give it a week, 2 weeks before you start making drastic changes and how your body responds. Make sure your skin is free of makeup or creams or lotions. They can absorb light or reflect light, that kind of thing. These LEDs are bright. They come with goggles. I'd recommend putting those goggles on. The light's not going to blind you, but you'll be seeing, bright lights afterwards for quite a while if you stare into those LEDs for any length of time. So be aware of that as well too, or close your eyes or protect your eyes to some degree, obviously. If you have any concerns about that, then talk to an optometrist or a healthcare professional about, any concerns you might have. In general, don't talk to your healthcare professional if you're going to start using photobiomodulation for anything. Because I say that because sometimes people will start treating things and not consult professionals. They don't even know what they're treating. So it's important to understand what it may be helpful for and what it may not be helpful for. Awesome. Okay, next webinar is on tackling tendon tears. This is more of a professional webinar, although anyone can listen in and watch. Thanks very much. Let's see what kind of questions we have here. All right. Where to get access to the first webinar on this panel? It's on, I think I mentioned that, it's on the BIOFLEX WAVE site. So you go to bioflexwave.com. When people are asking you about the difference between your system and others, what are the most important points to drive home? Yeah, well, I mean, some of them are pretty similar, like your Jews and what have you. Probably the main difference is that you can actually call me or email me and I can give you clinical guidance. That would be one thing. You get clinical support. They make a point of, and I was on the Jew site just before doing this one, is they say, hey, we're not clinicians here. Yeah, we know that. They're just selling it as a device, whatever. What we try and do is give you good education, try and provide clinical support. But the other thing is that we do believe that pulsing the light is really critical and can give you some extra benefits. So, so we do try to offer that on most of our equipment with respect to changing the pulse rate. And not so much in the panels, but some of our other equipment have proprietary protocols that we've used for 3 decades that we know are effective as well. So all those things I'd say is where the main difference lies. Could you address the BIOFLEX P180 regarding time and intensity? Well, not really, because this isn't about the P180. Victoria, I have like 30 webinars on the P180. And if you're not quite sure after watching some of those webinars, especially the basics of how to use the P180, feel free to email me, but it's not really in the topic for today, just because it would be too involved for me to try and answer that right now. But I'm happy to if the webinars don't answer your questions. If you're really treating blood systemic effects, how does pulsing help with the brain or other organs if you aren't affecting them directly? Does the blood keep these frequencies as it goes to your body parts? Also, how many modes can you run? So I think I mentioned how many modes you can run safely per day. With respect to, that's a good point, by the way, with respect to the pulsing and how it's going to affect the say the brain or what have you, well, we don't really know. We don't really know how that's affecting the brain. In part, some of the treatments done with the eyes open and using pulses of light, so it will have an indirect effect mediated through the nervous system of the eyes as well. But we still don't know, Alan. And by the way, me mentioning about pulses and it's important, say, for the central nervous system, that kind of thing. This is still very experimental, still trying to figure out, where this is going, but they have found that pulsing the light is helpful, and the effects in the brain and the central nervous system are most likely mediated systemically. I mean, Michael Hamlin talks about that, and he's considered the world's renowned expert on photobiomodulation, especially on the central nervous system. So more than likely it's indirectly, and why the pulsing is helping. He has some hypotheses out there, but we don't know yet. Is there a document that delves more deeply into the parameter customization? Um, I don't really have a document per se. I have trainings that I talk a bit about customizations for our professional equipment, for sure. I've tried to give you the basics today of the concept of pulses, but and sort of, you know, where you want to start and where you can go and the different ones to try. It really, I mean, I think that's a good starting point. If you're interested in delving into a lot more about it, there's not a lot out there that's published, but I can send you some research if you care to email me. Hertz or pulse rate, visually speaking, is like frame rate for video. Yeah, exactly. Cost, I don't know what the costs are. Like, I'm the clinical guy. Go to our website, you can find out what the costs are. I think they're pretty competitive. I think they're less expensive than Juve, and you be similar, if not better, and you get clinical help. We're clinicians here. Safe to have the panel near the skin. Well, I mentioned that, you know, it's recommended to be around 6 to 8, 10 inches from the skin. Any closer, you may be overdosing it. And so it's going to damage your skin, but it's going to be too much light. And in general, that's the consensus as far as how far away you'd want to be. Okay, I'll go to the chat. For using the zone on beauty mode, is it safe not to wear glasses but keep your eyes closed? Yep, that works. For those brain benefits, where would you place the array? I missed that bit. Yeah, so I think if you're trying to use panels for cognitive functioning and help, that kind of thing, probably on the face is where I would do that. I would say that'll have the most benefit. To be honest, if I'm trying to get effects cognitively, I would use something that touches the skin, equipment that touches the skin. Radio waves and microwaves are not safe if exposure is prolonged. However, short-term exposure shouldn't be a problem for most people using light therapy. Okay, well, I mean, one can debate this. I mean, we're surrounded by radio waves all the time, constantly, so I think they're pretty safe. I think when it's high intensity, there's problems. So I don't mean to dismiss it that way, but on low intensities, we're surrounded by waves all the time, and I don't think, I mean, you know, how problematic that is. Can we have the panel touching your skin? No, no, no. I already said, don't let it touch your skin. It gets super hot too. You'd burn yourself probably. A wife treating her husband's poor blood flow and resulting poor skin on his calves. Is that a question? I'm not sure. So you can email me, Victoria, if you'd like. I think it would be helpful for blood flow to some degree, although I prefer touching the skin for blood flow. Okay, I think that's it. Thanks everyone for joining me today. I really appreciate your time, unless there's any other questions. When using the BIOFLEX, the rays on the skin with no problem, is it because of the amount? Yeah, because of the way it's designed. So these LEDs are really strong, like they're pumping out watts of power. So when they're away from your skin, you're losing up to 85% of the energy. So you're going from, you know, this amount of energy to a much smaller amount by the time it enters into the body and it's from a distance. So with respect to that, you don't need as much energy when you're touching the skin, which makes a lot of sense. It's really hard to know the dosaging that goes into your body when you're using panels. That's why the consensus right now is to, to give you some wellness systemic effects, skin direct effects, probably for sure, but not a specific dosage to a specific area like you would if you're treating a tennis elbow. I mean, if you put your elbow in front of a panel to try and help tennis elbow, it may be helpful for sure to some degree. It's just that, why would you do that? Why not just get something that you can impart a specific dosage of light to that tissue that's trying to heal, and that will give you the most bang for your buck as far as trying to heal something. And that's where all the research is for healing tissues, right? Okay, Thanks very much. Hopefully you found this helpful, and have a great day. We'll see you soon. If you're out in the Vancouver area, we're going to be out there April the 6th for a Light Up Your Practice. If you're a healthcare professional, you're looking at adding light therapy to your practice, and you're in that Vancouver area, or hey, you want to go to Vancouver, go to our website, bioflexlaser.com, and go to Light Up Your Practice, and you can see the details there. Thanks so much. Bye now.